Day in and day out, healthcare workers are on the job, tending to patient needs. It's a career that can be quite demanding, often taking a toll both personally and professionally. But what can be done when it's a healthcare worker who needs some help? In our cover story, RodSTARNS shows how employees at Baptist Hospital are taking the proverb, "Physician, heal thyself," to heart.
Heather WYNNE is a registered nurse with Baptist Trinity Hospice.
Part of our job description is to care for dying patients who typically have hours to days to months to live. It can be very stressful. It's a wonderful, rewarding, my favorite job I've ever had, but at the same time, the job itself has its own set of stressors. And then you combine whatever's going on with your personal life. Sometimes it just got to be too much to handle.
For Heather, the start of her career at Baptist Trinity marked a time of great change in her life.
I was pretty freshly post-divorce, had become a full-time employee for the first time in my life with the stress of caring for dying patients. I had 4 children at home. They were all in new schools and everything was changing, and my life was changing.
Dealing with those changes wasn't easy. Heather knew she needed some help, not only for her sake, but for the sake of her family, her patients, and the families of those patients. That's when she reached out and got the help she needed.
This is Judy Buckman.
Meet Judy Bookman, a counselor with Concern, an employee assistance program.
It started because a group of pretty savvy employers got together and said, you know, some of our employees go through a lot of personal problems. They have issues, things that obviously affect the quality of their work.
The counselors at Concern truly live up to that name by assisting a wide base of clients, everything from government and law enforcement agencies to education and manufacturing. But it's in the area of health care that counselors like Judy see a special need.
They are under extreme stress. Frequently there are emergencies, traumas that come in, and also patients and their families are sometimes not at their best when they enter a healthcare facility. So you have all of those emotions going on, plus you have a pool of workers who have their own lives and their own issues.
Judy and her Concern colleagues help employees deal with a variety of challenges on a personal level: stress, health and financial problems, alcohol, drug, and legal issues. Also, how to handle violence and other family-related problems. And her help extends far beyond just one-on-one counseling.
When there is a situation in the workplace, then sometimes I'm asked to go in and devise a program that will help all people.
What are the different kinds of behaviors that you all don't like, or attitudes?
We caught up with Judy while she was conducting a seminar called Toxic Coworkers with the surgical team here at Baptist. When it comes to dealing with challenges in the workplace, Judy always stresses the importance of preventive maintenance, a topic this team knows a little about.
When somebody comes in and they're grouchy, it is contagious. Now, y'all know about infection control, but I'm here to tell you about mental infection.
It is high stress, especially in surgery. You figure you're in a confined area. You can't just get up and walk away if somebody irritates you.
You realize that your personality and your outlook and your attitude definitely reflects how your day's going to go and how your team's going to go.
I thought it was great. Really helps with dealing with a lot of personalities that there are in surgery. And like she said, in all workplaces.
Part of what they showed me at Concern was how important it is to balance it all. Taking care of yourself so that you can take care of your family, your patients. So they were really good about suggesting practical things that I could do. Start exercising, making sure I was eating right, taking time during the day to take little breaks.
By employing the techniques learned through Concern, Heather was able to get things back on track, personally and professionally.
When I started this job, I was a very different person than I am now, and Concern, again, was very helpful in helping me make that transition.
Ultimately, what's good for the healthcare worker is going to be good for the patient, because if a healthcare worker is in good shape, then in turn you're going to see the patient getting a better quality of patient care.
For Smart Medicine, I'm RodSTARNS.
Joining us now is Director of Human Resources at Buckman Laboratories, Chip Westbrook. And Mr. Westbrook, thank you for joining us here on Smart Medicine.
Glad to be here.
All right, let's talk about why your company chose to use Concern.
We were looking for a solid benefit for our employees that would help folks get through some of the normal stuff of life, the trials and tribulations and that kind of thing. And we were looking for not only somebody that could help locally, but our salespeople are scattered all over the United States, and somebody that had a national presence and could help us with our employees across the country. And it was a benefit that they were tied in with Baptist Hospital, which is our primary healthcare provider and who we go to.
What kind of changes have you noticed since you began working with Concern?
Really good changes in that they've kept up to date with treatment programs, kept up to date with training programs, kept up to date with what's happening in the world, and so they've been able to meet our needs, whether it be with our local employees or a drug-free program that we use them to set up.
Why is it so important to offer employees emotional support?
It's kind of short-sighted, I think, of employers to not think that we employees bring all our trials and tribulations to work with us, whether we'd want them to or not. And in order to try to provide the best place we can for folks to work in, then it makes sense to be able to offer them support when they most need it, and they're probably the most reluctant to speak about it. So this is a way for people to get the help they need without having to go to HR, without having to go to their boss, without having to go to anybody, but they got a phone number and they can get some help.
Chip Westbrook, thank you so much for joining us.
Thank you.
From Buckman Laboratories today. To learn more, head over to WKNO.org and click on the Smart Medicine icon, or check out smartmedicine.tv.